Prior to proceeding with this assessment, here are the important materials or equipment that we need in this return demonstration. Examination gloves, tongue depressor, 2x2 gauze pads, and lastly, flashlight or pen light.
Good day, ma'am. I am student nurse Lian Alan from Columban College, and today I will be assessing your mouth, oropharynx, and neck in order for us to see whether or not there are presence of abnormalities in your body and to facilitate treatment as soon as possible, okay? And I will be asking you some few questions regarding your past medical history in order to correlate them with the potential findings that we may find during this assessment. So do you consent to that, po?
Yes.
Okay, so assuming I have already washed my hands in order to prevent cross-contamination between the client and student nurse, I will now provide the client with privacy in order for her to feel comfortable and relaxed during this entire assessment. Okay. Proceeding now with the mouth and oropharynx interview. Okay, so ma'am, can you first tell me what is your name?
My name is Jean Real.
And how would you like me to call you?
Jean.
Jean. So Jean, how old are you?
I'm 16 years old.
16 years old. And when is your birthday?
January 21, 2006.
Okay. And lastly, where do you live?
Hansen.
Hansen. Okay, so Jean, can you tell me your routine pattern of dental care?
I brush my teeth 2 times a day, floss and mouthwash.
So, can you tell me when is your last visit in at the dentist?
Last month.
Last month. Are there any presence of lesions or ulcers in your mouth?
None.
None. Okay, so how about any medications? Do you take any of them?
I only take vitamins.
Okay, what kind of vitamins?
Ascorbic acid.
Ascorbic acid. So Jean, I just want to position you in your seat for you to feel comfortable and to facilitate this assessment smoothly. So, do you feel comfortable at all?
Yes.
Okay, so Jean, can I ask you to purse your lips as if you're about to whistle or blow? Okay, so I see that the client's lips are symmetrical. There is no drooping on one side and the color is pink. It is moist and it does not have any presence of lesions and abnormalities. Okay, so Jean, you can now let go. I will now inspect and palpate for the client's buccal mucosa to see if there are any abnormalities inside of the mouth. Of course, I will use my tongue depressor and my pen light to see the inside of the client's mouth. Okay. Okay. Miss Jean, can I ask you to open your mouth? Okay. So. Okay, so the client's buccal mucosa is moist, and because the client is light-skinned, I saw that the client's buccal mucosa is light pink. It is moist. The texture is also smooth, and there are no presence of lesions. Jean, can I ask you once again to open your mouth? So what I am doing now is that I am checking or inspecting for the client's teeth, and I see that the color of the teeth is lightly yellowish, which is common, and the number of teeth has a total of 28, and I see that the condition is normal because the upper molar is resting directly on the lower molar. The client also does not have any repairs or accessories present on the teeth. And because the client does not have dentures, we will now proceed with the next step. Jean, can I ask you to stick out your tongue for me? Okay. So I see that the client's tongue is in midline position, which is normal, and the color is lightly pink. It is also slightly pale, which is normal, and the texture is smooth, moist, and with no presence of lesions that may indicate leukoplakia or the persistent lesions and ulcers present on the client's tongue. Now, Jean, can I ask you to move your tongue upwards and sidewards? Okay, so the client did that with ease, meaning that the client's frenulum is not overly short, that this allows the client to move her tongue freely. Now I will palpate the base of your tongue if there are any lesions and if the salivary ducts are palpable. I will use my clean gauze. Can I ask you again, Jean, to stick out your tongue? Okay. I will just palpate the tongue. Okay, so the client's tongue does not have any nodules or lesions present on the base and the inferior part of the client's tongue. So I will now dispose the used gauze. Inspecting now for the client's salivary glands, we know that we have a total of salivary glands, which is the parotid gland located on the anterior of the ear, the sublingual gland located below the tongue, and the submandibular gland, which is located below the mandible. Now, I will inspect if these the glands openings on the client's mouth has any presence of redness or swelling. So, Jean, may I ask you again to open your mouth for me? And lift up your tongue. Okay, so can you open your mouth wider? Okay, so there are no presence of redness, lesions, and swelling on the client's duct opening, meaning that the client does not have any kind of infection present on her mouth. Inspecting now for the client's soft and hard palate. So, Jean, can I ask you again to open your mouth widely? Okay, I see that the hard palate appears to be pale or whitish with a firm transverse rugae or the wrinkle-like folds. And I see that there is also a bony prominence along the midline, which is a common variation among females and like Eskimos, Native American, and Asian. Now for the soft palate or the soft palate, it also appears to be pinkish, smooth, soft, spongy, and movable. To check now for the uvula, I will ask the client to say "ah" to see if the uvula rises as well as the soft palate. Okay, so Jean, can I ask you to say "ah" for at least 3 seconds? Okay. So the client's uvula has rise, meaning that the client did not have a cerebrovascular accident. That this allows the uvula to rise as well as the soft palate. Inspecting now for the oropharynx and tonsils. I want to make sure that I check the oropharynx with the tongue blade one at a time to avoid gag reflex. So, Jean, can I ask you again to open your mouth and stick out your tongue? Okay. Okay, so the oropharynx appears to be pink with no lesions or exudates that may lead to pharyngitis. Now to check for the tonsils, you can open your mouth again. The tonsils are present. It is pink, symmetrical, and has no swelling or lesions. The size is also graded 1, which is normal. And clients who have red and enlarged to grade 2 may have a condition called tonsillitis or infections on the tonsils. So, Jean, I will now test your gag reflex. Is it okay with you? Do you still feel comfortable in your seat?
Yes.
Okay, so can I ask you again to open your mouth? Okay. Okay, so now that the client gagged, meaning that the cranial nerve, which is the hypoglossal nerve, is intact. Proceeding now with the assessment of neck. So, good day again, ma'am. I am student nurse Lian Alep from Columban College, and today I will be assessing your neck to see if there are any abnormalities in your neck and to facilitate treatment as soon as possible. So, I will be asking you once again a few questions regarding your history. Do you consent to that, ma'am?
Yes.
So, rest assured that all of the information that I have gathered and will be gathering will be kept confidential between the attending physician that I will be attending you to and between you as the client. Okay? So, assuming once again that I have already washed my hands or performed hand hygiene in order to prevent cross-contamination between the client and student nurse, I will now again provide the client with privacy in order for her to feel comfortable and relaxed during this entire assessment. Now with the interview and history taking of the neck. So, Jean, have you had any problems with neck lumps?
None.
Okay. How about any neck pain or stiffness?
None.
None. Any previous diagnosis with thyroid problems?
None.
And how about any treatments such as surgery or radiation?
None.
None as well. Now for the assessment of neck muscles, which are the sternocleidomastoid and trapezius, we know that these two muscles come together as a team in order to allow movement and provide support for the neck and head. So, Jean, can I just ask you to sit erect? Okay. So, the sternocleidomastoid does not have any kind of abnormal swelling and bulges, as well as the trapezius. So, is it okay, Jean, if I move your head in certain directions to determine the function of sternocleidomastoid and trapezius? Okay, so I will once again perform hand hygiene. I will just move your chin. Okay. Did you feel any discomfort at all while doing the procedure? Okay, so the client did not have any difficulties in doing this procedure, meaning that the sternocleidomastoid and trapezius normally function on the client's body. So we can see that the client's neck is symmetrical, the head is on the center. So Jean, I would like to test your muscle strength. So I will ask you to rest your shoulders in resistance with my head. Okay, on to the other side. Okay, on the shoulders. Okay, so as we have seen, the client's muscle strength is intact and does not have any weaknesses on her muscles. Inspecting now and palpating on the client's lymph nodes on the neck, we all know that the normal size and shape of our lymph nodes are round, about 1 centimeter, and are not palpable. So I want to see if the client's lymph nodes in the neck are palpable with different kinds of swellings and tenderness. So Jean, is it okay again if I touch your neck to check for any kinds for lymph nodes? Okay. Okay, so can I ask Eugene to sit erect? Okay. So, Okay, so as for the palpation, I did not notice any abnormal swelling on the client's neck, meaning that the client does not indicate cancer on the nose, sinuses, mouth, and neck. So now for the palpation of the trachea, I want to see if the client's trachea is in normal position by placing my thumb on the suprasternal notch. Okay, Jim, can I ask you again to sit erect? Okay. Okay, so the client's trachea is in normal position. It does not have any deviation and it is located on the midline, which indicates a normal finding. Proceeding now with the inspection, palpation, and auscultation of the thyroid gland. As mentioned earlier, the client's neck is symmetrical. The head is at the center with no visible masses, nodules, or lesions. Now, can I ask you, Jean, to hyperflex your neck or your head and to swallow for me? Okay, so the client did that with ease, meaning that there are no enlargement of the neck or the thyroid. And is it okay, Jean, if I palpate your thyroid gland? Okay. So the thyroid gland is smooth with no masses and nodules. Okay, so I want to just auscultate if there are any presence of root. Okay. Okay, so there are no presence of soft or swishing sound that may indicate that the client has hyperthyroidism due to an increased blood flow through the thyroid arteries. So now that I am documenting the client's overall findings, so the client does not have any abnormal findings on the body. The client is overall healthy. Okay, so thank you so much, Jim, for participating in this assessment. I hope that you and your family continue to be healthy and safe. So we'll see you again next time. Thank you.
Thank you.
That is it for today's video, and I am student nurse Lian Alec from Columban College. Until next time.